Alright, so we will start with myocardial ischemia. Myocardial ischemia occurs when the supply of the blood to the myocardium from the coronary arteries is insufficient to meet oxygen demands. Common outcomes include angina pectoris and MI, or myocardial infarction. Angina pectoris is an imbalance between myocardial oxygen supply and demand. Typically, angina pectoris presents as left-sided pain. It can be aching, it can be sharp, there can be pressure or tingles. Now, it presents as left-sided, and it can radiate to the left arm or both arms. It can radiate to the jaw, neck, or the back, and sometimes it doesn't radiate. Now, angina pectoris only lasts 3 to 5 minutes. A cause of angina pectoris could be eating heavy meals or stress or exercise. Now, it's important to note that angina pectoris lasts 3 to 5 minutes, and it can be relieved with nitroglycerin. Myocardial infarction, or acute coronary syndrome, occurs when there is a sudden decrease in blood flow or an increase in oxygen demand. Cellular death occurs after 20 minutes of myocardial ischemia. Now, for men, chest pain can be crushing, squeezing, or stabbing. The left chest is typically affected. It can radiate down to the left arm, to the neck, to the back, to the epigastric area. For females, they might have angina, fatigue, indigestion, shortness of breath, back or jaw pain. Now, it's important to note that myocardial infarctions typically last more than 20 minutes. Rest does not alleviate the symptoms of myocardial infarction, and nitroglycerin does not relieve the pain of myocardial infarction. Now, when we're talking about respiratory disorders that influence oxygenation of the body, we think of infants and toddlers because they're typically exposed to secondhand smoke, and they often have nasal congestion. For adolescents, they may start smoking, and they continue smoking until middle age, and this puts them at an increased risk for cardiopulmonary disease and lung cancer, which can both influence oxygenation. Now, young adults and middle-aged adults are exposed to typically unhealthy diets, sedentary lifestyles, stress, illegal substances, and smoking. For older adults, they go through developmental changes that are normal for the aging process, but not necessarily good for the body. They may develop osteoporosis, airways and heart valves calcify, functional cilia is reduced, causing decreased effectiveness of the cough mechanism. Lifestyle modifications can be to stop smoking, eating a healthier diet, and exercise. Eating omega-3 fatty acids, lean meats, fruits, vegetables, fiber-rich diets, or fiber-rich foods, and restricting sodium in the diet can all be beneficial for individuals. Now, we do want to make sure that we alert women that are taking birth control and smoking that they're at an increased risk for blood clot formation. We also want to be aware that drugs reduce the amount of force of respirations, which decreases the oxygen intake. This is important for anyone who may use prescription drugs or someone that you suspect of illegal substance abuse. A continuous state of stress or severe anxiety increases metabolic rate and oxygen demands of the body. Environmental and occupational pollutants increase risk for heart disease. When we're obtaining a history, we want to make sure we ask our patients about chest pain, fatigue, dyspnea, cough, wheezing, any environmental exposures, smoking, respiratory infections, allergies. Hemoptysis is bloody sputum, and it's alkaline. Hematemesis is bloody vomit, and that's typically acidotic. Now, when we're gathering a history on our patients, we also want to be inspecting them for any clubbed nails, which indicate a prolonged oxygen deficiency. We want to observe for accessory muscle use. We want to observe for bradypnea and tachypnea, less than 12 respirations or greater than 20 respirations. We also want to ask these patients if their spouse ever says that they snore at night or that they stop breathing at night, okay? Now, apnea is the absence of respirations lasting more than 15 seconds. Kussmaul's respirations are deep and labored breathing, typically present in metabolic acidosis. They can occur with hyperventilation. Now, Cheyenne-Stokes respirations occur when there is deeper and faster breathing, followed by a period of apneic breathing. This occurs when there is a decreased blood flow to the brain stem. We always want to inspect our patients first, then auscultate. We would auscultate for the presence of irregular heartbeat, any murmurs, listen to lungs. Then we can percuss the lungs, and then we can palpate for any thrills, heaves, edema, and at the site of the PMI, or the point of maximal impulse. Now, there are several different diagnostic tests that can be ran. There are blood studies, cardiac diagnostics, ventilation, and oxygenation studies. Blood studies include creatinine kinase, which is a cardiac enzyme that is used to test for myocardial infarction. The normal ranges for a female are 30 to 135, and the normal ranges for a male are 55 to 170. We also have troponin, potassium, cholesterol, and triglyceride levels that are considered for our blood studies. Cardiac diagnostics consist of Holter monitoring, which is a portable monitor that produces a continuous ECG or EKG, typically worn for about 24 hours, and then the doctor will take a look at those readings. Now, stress tests involve the EKG being monitored during exercise or when certain drugs are pushed. Cardiac catheterization is used to visualize the chambers, valves, and coronary arteries. Pressure and volume are measured. Ventilation and oxygenation studies include ABGs, which assess the acid-base balance. ABG stands for arterial blood gas. We have PFTs. PFT stands for pulmonary function test. PFTs determine the ability of the exchange of oxygen and carbon dioxide. We also have thoracentesis, which is to remove fluids for therapeutic purposes or to take specimens or both. And we have sputum cultures. Now, they cannot just spit into a cup. This sputum culture needs to be from the lungs. Some characteristics of impaired gas exchange are typically decreased activity, confusion, fatigue, irritability, restlessness, dyspnea. We can see some accessory muscle use, nasal flaring, tachypnea, diaphoresis, pallor, cyanosis, and distant lung sounds. Now, it's recommended that everyone 6 months of age and older have the flu vaccine, especially those with chronic illnesses. I do want you to know that humidification is when water is added to a gas, and that nebulization adds moisture or medication to inspired air by mixing particles with the air. You might see TCDB and that is turn, cough, deep, breathe. This is very important for our patients. Chest physiotherapy is used for mobilizing secretions. Now, postural drainage consists of drainage, positioning, and turning, and can be accompanied by chest percussion and vibration. There are different positions to assist with postural drainage. Chest percussion involves cupping the hands and clapping on the chest wall. It's contraindicated in osteoporosis and bleeding disorders. And there are vests that can be used for vibrations of the chest wall. Now, with suctioning, we can always suction the airway if the patient can't clear their own secretions. Now, just so this audio doesn't cut me off, I'm going to go ahead and end it here, and then I'll pick back up.